Hi, everyone. Super excited here to be going live with you with Dr. Tammy Del Sol from HErD Dental. Um, yeah, we wanted to answer some questions. If anybody wants to go live and ask questions, by all means, we've been collecting a ton of questions from you guys, especially from Facebook and the Facebook groups. That's the reason why we decided to go on here and show you guys how the HErD Star works. But before all of that, wanted to introduce Dr. Tammy Del Sol. She's the founder, CEO of HErD Star Dental, the Star company, and she'll talk to you more about what the HErD Star is and a little bit of her background as well.
Yeah, so I'm Tammy. All my patients just call me Tammy.
I can't call you that.
Really? No, they do. I just introduce myself as, "Hi, I'm Dr. Del Sol," but I just go by Tammy, and then
I
everyone
know,
calls
but
me.
I can't.
It's so easy. I mean, I really like it when we're all on a first name basis. It's because no one's above or below anyone else. It's
No.
that's the way it really is. But in any case, I had carpal tunnel and trigger thumb from holding these cylindrical handles, and after my carpal tunnel syndrome surgery and trigger thumb, I decided during COVID, when I had some time, to figure out a way to redesign these handles so that we didn't have to pinch it as hard. And after a ton of iterations, I basically came up with these, what we're calling the HErD stars. HErD, Hajar Ergonomic Designs. My dad was Dr. Hajar. He was a dentist. And so it's a tribute to him. And so when you put these stars on these instruments, what it suddenly does is, instead of the pinch grip pulling, it allows a latch pull. Like, think about opening your fridge or any of that. So that's one major feature. And the other one is that you can rotate it digitally. There are no instruments right now that we rotate digitally. Every time we want to rotate anything, it's all wrist. There's no precision in that. But now we're engaging all those nerve endings at the end of our fingertips. It adds a lot more precision. It adds a lot more comfort and ease of use. So that's it in a nutshell. Maria.
Yeah. I wanted to go ahead and, for the record, I wanted everyone to know exactly what my partnership looks like with you.
Okay.
I actually had carpal tunnel surgery in both hands, my dominant and non-dominant hand, and it really had to do more with pregnancy. Unfortunately, I was super swollen, looked like an elephant, very, very just full of fluids. And by the time I was like
Really?
6
I really
months,
can't imagine that you look like an elephant. Who are you kidding? Come on now.
I should post a picture right below, right after
Yeah,
this.
you
So
should.
I can
Okay.
all and vote and see. But I don't know if anybody has had any type of carpal tunnel syndrome
Yeah.
due to pregnancy, but I definitely had when I was about 6 months pregnant. And post obviously pregnancy, I ended up pushing for surgery. I wasn't 100%, and I had already met my deductible, so I figured, listen, if this is something that's going to keep me from probably practicing 20 more years, then I
Yeah.
definitely want to just do it now. So thankfully, I did surgery, pursued it, and I didn't have a problem. I know some people don't have that good of a luck to, have everything go well, but that's my story. That's one of the reasons why I believe in the mission and vision of your company and what you're trying to do. And I've been able to work with you now for a few months, and I am a huge advocate for these. There's no other solution out there from what I've been able to see. There's other solutions out there that's great. They help with loops, with your eyes, with your chairs, right? There's even straps to hold the instruments a little lighter, but this is completely different. And
Yeah.
that's the reason why we wanted to go live, to explain as to how that works, because there was a lot of questions around that. So that's my background. And if you see Maria Dental AI on Facebook, is because I'm not trying to hide. I'm a hygienist by trade, been working for dental companies for a long time, but now I went back to school, got a master's in AI, and now I work with AI startup companies. Dr. Tammy Del Sol is the only non-AI company I work with, but again, it's because I believe greatly in their mission and vision in their company. So you'll see me advocating a lot for what they're doing, and you'll see me behind their booths a lot as well. So moving forward with the questions that we're getting,
Yeah,
I want to go over the small little stars. There's
yeah,
two different stars that we have currently, right? We
yeah,
have
yeah.
small little star and we
With the
have
internal star, it's the small one, and then the circular diameter, we that one comes in many different colors, but the small one for the skinny mirrors only comes in one internal star. That's the small one.
right. And the instruments that fit into this specific little star are
Yeah.
the little mirrors.
The small diameter, like this is actually a scalar, and I don't think, I don't know how many small diameter scalars there are, but this is a skinny one that would have this on here. Also, like you said, well, there's an Explorer
An
Perio Pro.
explorer,
Yeah,
yes.
and there's the little skinny mirrors that do not get thrown out because they never wear out. And so it's like these guys who have these practices and like, oh, I think it's perfectly fine. I'm like, no, it's small and uncomfortable and it's breaking the hands of your staff. But that's why the star on here really changes the instrument handle completely. And I feel like, all right, fine. If you're going to keep these skinny mirrors, get some stars on there and give your staff a break. So that's kind of my take on that.
Since we're on this little diameter star, can you show us, for example, a dental assistant? Because I know a lot of your dental assistants
Yeah.
use the stars. Why it's important, like the whole pull retraction.
Yeah, so I mean, the dental assistants have to retract the tongue and have to pull cheeks all the time. And
Yeah,
by the way, this is another thing that we've created, the HErD RTA, removable tongue aid. I would love to get this into schools. So there's we remove the bottom and put some Velcro in here, put Velcro, design this tongue to fit perfectly in here. Very easy in and out. But in any case, it really simulates what a tongue is like. And in
that's right.
regarding the assistants, they just latch pull. They're holding their star, latch pull, and they're just retracting. It's easy. It's a latch pull. And they
Instead
can
of
push
pinch,
or pull. Yeah. And instead of like doing this, they're just doing this. Look how relaxed my hand is. It's so easy.
if
It's
you're
so
holding and
easy.
contracting for some a really long procedure, you might
Yeah.
not feel it if you're doing it here and
Yeah.
there. But if you're retracting for a very long procedure,
Yeah.
I mean, I'm
Yeah.
sure you guys feel it.
Yeah. Yeah. No, it really is kind of like, a hand saver by putting these on the dental mirrors for assistants and everyone. I mean, the hygienist has to retract too while they're
Yeah.
cleaning, and so does the dentist. So, we always, as a dentist, I've had that mirror in my hand all the time and my handpiece generally. So, yeah,
Also, do you have the scalpel that fits in this
yes,
little? So
yes,
that's another example where this would fit perfectly.
yeah. I mean, scalpel, William Schott in 1892 took the brilliant idea of taking a knife and turning it into a scalpel, surgical knife, and then it turns into a scalpel. But the way you have to hold this is absolutely miserable. And this design hasn't changed since 1892. How was that possible? So when you take this small diameter and slip it on here, and it's nice because it's all these internal grooves allow this to fit so nicely on here and allow you to have, look how comfortable my hand is. If I'm pulling back against any tissue, if I'm rotating, it's so easy. Whereas without it, look what my hand does. Without this, I'm doing this. Do you see that? Does that look at all natural? No, it's not natural. That's why we have to open up our hands and figure out how to, that's basically how I did it. I figured it out by just like, well, all right, hand, what do you want to do? And it just, my hand, I'm going to sound like a freak, Maria, but my hand said, I want to be relaxed. I want to be as relaxed as possible. And I'm like, okay, so I threw a gob of clay in here and worked backwards and doing this, reverse engineering. I somehow came up with this star, but it started with my hand wants to do this. How do I create something that allows my hand in this position? And that's how it really actually happened.
Perfect. So that's the little star. Now
Yeah.
let's move on to the other star.
Yeah.
Your which comes in four colors.
Regular diameter, and it comes in light pink, blue, black, and dark pink. Okay, for these top four colors. Okay, And the nice thing about having different colors, Maria, as you know, is that you can color code your instruments. If you put the darker pink on the distal aspect of the curette, am I even saying that right? There is a distal aspect, right? Like I must sound like an idiot, but hygienists have,
So back in the days, they used to have like a right and left, right? But now
okay,
they've created it. But again, they try not to color code it like that in school because they want them to know which side is which, if it goes on the upper right or lower right or whatever quadrant it goes to. But they know what you mean,
but
color
I know, but
code.
they're out practicing, and now, like, screw it. We don't need to be tested anymore. We just want to know where it is and, grab it
Yeah,
and just go, So that's the advantage of having two different colors, whether you have, the pinks or, blue and black or blue and pink or whatever, you can
yeah,
easily, color code these instruments, and they go on all these regular diameter instruments. So they go
yes.
on just about all these, they go
Even
on the Zerk, they go
is
on the Zerk, they go on anything else except the skinny ones.
yes. Now, you could also color code, and I've noticed some hygienists come to the booth and there's like two or three of them and they all want to get it. So sometimes one person does baby blue, baby pink, black, and then they'll mix and match, and then that's
Yeah,
how they know whose instruments is whose. So
yeah,
that's another reason why you have all the
yeah,
different colors.
yeah.
Um, so let's talk about the packs and what they get. So there's
Okay.
two different packs. Let's start off with the smaller pack.
Okay. So in the small pack, you get four you're either going to get four regular or four small. And in the regular, they normally come in either, two pink, two dark pink, two light pink. And if you get the other ones, you get two, two blue and, oh, four blue. My daughter is correcting me. So you get four.
I mean, it's online, by the way. If you guys want to see
Um,
it, go into like to shop online.
Yeah, you can get four blues or four blacks, and in the other four pack, you can get two pinks, two light pinks, dark pinks and light pinks. So
Yes.
that's what you can get. And if you really want something different, one of each color, then just put a request in, and we'll accommodate.
Yeah. So some of the
That's the
packs
four packs. That's the four
that's right.
packs.
That's the 4 packs.
Yeah,
And so one reason why some people would get 4 packs, they want to start off, they want to try it out.
yeah,
A good place to start would be maybe your mirror, your Cavitron,
yeah,
or try it out in your universal instrument, however you want to try it out. And then maybe you want to graduate into like a bigger pack.
yeah,
Now, these
exactly.
are autoclavable, right?
Fully autoclavable.
Fully
They're fully
autoclavable.
autoclavable. And I forgot to tell you that in the four packs, you can get four. Oh, this is up. Why do I have it? Well, because you can knit with it. But I mean, you can get four of the small ones too. I mean, if you just have a ton of skinny mirrors and skinny handles, just get a 4 pack of small. You can do that
Yes.
too.
Now, the big pack. How many do
Yeah,
you get on the big pack?
you get 10. You always get 10. And you get two smalls and the rest regular diameter. So in the two types of 10 packs we have, you get four blues, regular diameter, four blacks, regular diameter, and then two of the smalls. And then in the other 10 pack, you get four light pinks, four dark pinks, and then two of these smalls. So they have 10. It's called like a starter kit or an intro kit. It helps people understand, what it's about, and they can also use small because it seems like just about every practice has something small that they can put those small diameters on. That's why we have that.
Yeah. So that's basically it in a nutshell. Can you think of any other questions that we've gotten other than what do the colors mean? But it's just, I
I think
mean,
sometimes people ask me questions about the Cavitron. Do you know what I mean? And
what, 1, 2, how
yeah,
many, how does,
sometimes people like, well, why are there two on there? Well, because the hygienist in my former practice liked two. She liked the one for the front, and then when she's working in the back, the patient's mouth, she likes to have one further back. So um, there's that. So and then you can put them on a trophy angle. So I mean, it's really nice. It gives you a lot more control. So these are two things. As a dentist, I use it on my slow speed. Not only does it absorb vibration, and it will do that on the Cavitrons too, I can rotate it. It's so easy. And I like to put it on my high speed. which is awesome. And I put it on my electric handpiece too. So just allow, if we really want the wrist to stay in a neutral position, I mean, think about it. The more the wrist is in a neutral position, and what I mean by that, it's not doing this. So if the wrist is staying in a neutral position, what instruments, tools, anything do we have to allow us to do that? There's nothing except the star. And I'm not trying to brag on it, but honestly, there's nothing to rotate this except the star. Otherwise, you are rotating and using a wrist movement, and it's not as precise as engaging those nerve endings. So it is what it is.
Yeah. So their website is
That's
herddental.com,
fine. Yeah.
HErD dental.com. They
Yeah.
also have other socials. I mean, you can go to their website and you'll see they have a ton of testimonials, people that you may or may not recognize, but there's people that have been using your products for how long? What's the longest time that they've been using the
Well,
stars?
we launched it in at the Chicago Midwinter of 2025, so a little over a year ago. So I would say the longest people have had them is like what is that, a year and a half? But I mean, in my old practice, where when I started creating them in like 2022, they've been autoclaving them for the last 3 years or 3.5 years.
They've
So
been using
that's
it. So,
how. Yeah,
because I know I've seen some questions on Facebook like, "Oh, they're so expensive." And I get it, right? Like it's just another expense,
yeah,
but it's like a one-time investment for like a
yeah,
very, very long time. So once you buy a few, then you could always add a few more
yeah.
and we're good
And one
for a
thing
while.
And one thing I want to tell you, so when you put these, we say technically until we get a study to say that we don't have to do this anymore, we tell everyone take the stars off before you autoclave. Okay. I know that, sometimes people don't do that, but if you put them in a cassette and, it gets smushed up against this metal, it can potentially distort. So if you take them off and they're just kind of floating around in the cassette, they should be fine. In bags, they're fine. They don't get, so the people who do leave them on instruments, even though we tell them you should take them off, uh, you know, that's, these are the setbacks that are there. But eventually you know, we're gonna offer wider cassettes to help. And these are gonna come out probably within the next 6 months or so, and that will also help. But we're gonna also try to get a study done to show that you don't really have to take these off. That's what
Right.
we're trying to push into a hygiene program, to get a study like that.
Yeah. And then there's a lot of talk between different programs, right? In order to support all of that, as well as we may even potentially be inserting kits. So more to
Yeah.
come on that to see, what. So everything is super exciting. And I've also noticed when we work the booth, right? The more and more we go to these shows. I mean, there's a lot of people that come back and then they've heard about her dental, not only through their coworkers or social media, but or they just want more, right? Because they invested in maybe like a pack of four and now they're
Yeah.
seeing you guys for the second time and now
Yeah.
they want to purchase more.
And
So
it's so crazy, Maria, because we launched a little over a year and a half ago, and about, I'd say, 30% of the people who come to the booth, they say, "Oh my God, I saw you." I mean, they've heard about it, and that's
yeah.
so cool. I mean, I would, so we're getting out there and we're getting traction, and it's really kind of nice.
So if you guys have any questions, we're more than open to answer. If I can answer on them, I would love to. If not, we can get Doc to answer them for you. But just comment, like, share, support. A great product, and the only solution out there to be able to really save your hands. I know that if I go back to clinical, I wouldn't work without them. I love them on my Cavitron and I love them on my mirrors. It really opens up the grasp instead of that pinch force. So, yes, if you have any questions, let us know. We would love to answer them and anything you need.
And the large ones are going to be coming out probably in the beginning of next year, and they're going to go on intraoral scanners or intraoral cameras and scanners, and also piezos, which is
Piezos, yes. For
going
those
to be
people
awesome.
asking
So
about
these are
the,
the large. They're going to come out probably at the beginning of the year,
yeah. So
next
follow
year.
along. If you guys have any questions, let us know. But
Okay.
I think we're good, right?
Oh, yeah. Okay. Thank you.